of Genie.
That's right. All right, everybody. Guess what? We're going to talk about coronavirus on episode 235 of the In the Tank podcast. As always, I'm your host, Donald Kendal. Joining me through social distancing, we have got Isaac Orr, policy fellow at the Center of the American Experiment. How are you, good sir?
Oh, virus-free for now.
Nice. All right. Fantastic. Jim Lakely, you are in the other room. We're in the same building. Jim Lakely, how are you? You are muted.
I am doing fine. Thank you. I enjoy the social distancing in general. And like we always do on this podcast, we're separated by a wall. So
that's true.
I think we need more walls.
More walls. And in a dark corner of an underground bunker is producer extraordinaire Andy Singer. There he is. And maybe joining us is Justin Haskins, although he is having technical difficulties and life difficulties. So we'll see if he's able to jump in at any time. Gentlemen, we had a little group chat going on. We have a group chat going on. And I said, are we going to talk about anything else other than coronavirus? To which Isaac responded that he's sick of coronavirus, which gave me a scare, I must say. But no, you're just sick of the topic.
I said sick of, not sick from.
Sure. Yeah. But you can see the confusion.
Yeah. Thank you for your concern for my well-being, Donnie. I appreciate that.
You're very welcome. Oh, it looks like we have Justin Haskins, editorial director here at the Heartland Institute. Are you actually here?
I am here. I am alive.
Nice.
I'm doing well. I'm not sure for how much longer that's going to be the case. They're shutting everything down all around me. It's only a matter of time before the government comes and takes me away.
That's right. That's right. So you're in an undisclosed location. Is that right?
No, it's disclosed. I'm in Rhode Island, which is basically like communist China without Chinese people.
Okay. All right. So, gentlemen, I got to do this every week. We're gonna do this for the foreseeable future, but I need to gauge your alarm scale. So Isaac, I think you jumped from like a 1.5 to like a 7 last week. Where are you? How nervous are you?
I'm holding steady, Eddie, at 7 because like I did all my jumping in one fell swoop because it was like, oh no, I could potentially get this now.
Sure. Okay. Justin, you were at a 1.5. Then I think last week you were up to a 2, maybe a 3. Where are you at now?
What's the scale?
1 to 10. Come on.
1 to 10? Well, he did 1 to 100 at one point.
No, so. Didn't. You answered.
Yeah, I think you did.
I did not.
The first week it was 1 to 100, and Justin and I were like we're all cocky, and we're like 1.
Yeah.
No, you misheard me. Go back and check the tape. So just 1 out of 10. Like normal people judging this.
Are we? I guess a 2, maybe. I guess the fact that they're shutting down everything around me has now moved it up to a 3. I guess.
Oh, it's up to a 3.
What is wrong with you?
Yeah, I don't know. I'm really not that worried about it. It sounds like there's some promising developments with a malarial drug that they might be able to use to treat it. And so I don't know. I think there's still good reasons to believe that things will turn around within the next couple of months. So I'm not super worried about it, but
you know what's going to happen? Like we're not all going to die, but like, do you realize what that's going to do to like the entire economy? You take 2 weeks off and you're going to have a decline in the GDP. We're talking like 2 months. That's, each month is 8% of the year. So it's going to be bad.
Yeah, I think that's I think that's inevitable. I mean, I think that's where we're at. I think that's going to happen. I think my hope is, and I do believe this is likely to happen. I still think this is likely to happen, that things will turn around relatively quickly because the whole foundation of this thing is based entirely on not even what the disease has actually done to people, but what they think it might do to them at some point in the future. So if all we get is some kind of medical solution or reason to believe this is not going to be a massive crisis, everything's going to turn around overnight if that happens, because it hasn't actually caused enough damage to impact the economy. It's the fear of it doing that. It's all based on fear. This entire thing is based on fear. So if there's a reason not to be afraid, then that will return things to a state of normalcy or something close to it. So I still believe that that's very possible that that's going to happen sooner rather than later. And I think that what we found out about some of the medical trials that's been going on with various drugs, some of them have already been approved by the FDA. There's good reason to believe that might work in treating this in treating this particular disease. And if it does and it's effective, then I think people's fears are going to start going down. It's just a matter of whether or not that actually plays out. Now, if that doesn't work and we're just sitting around waiting for a vaccine, a year into the future or something, if that's where we're at, then, I will get a little bit more worried at that point in time. Not about everyone dying, but about what it will do to the economy and society. So I guess I'm feeling more hopeful because of the news that came out earlier in the week about that malarial drug and perhaps some others that are being worked on now. That could change though. Next week I could be right up there with you guys next week, just because of the way people are reacting to it, not because of anything other than that.
Says Mr. Justin Haskins sitting on his throne of toilet paper.
That's why he's not on video. It's just entire place just lined with toilet paper.
Yeah,
but
yeah.
Jim,
he doesn't have any, and he's just covered in it.
Jim, I think you started off as like a 3. He was 2 different scores last time that averaged out to be like a 5. So where are you at now?
Well, I mean, last week my worryometer was 3 for the actual virus and 7 for the panic of the United States and the world on what's going to happen to them. And Justin is right. It's a lot of this strife is over what people think might happen because of the virus. The actual spread of it seems to be happening, but it doesn't seem to be. We don't have people dying in large numbers right now, and that's good. And as Justin said, there are now some drug treatments that people are trying to figure out to see if they can help mitigate the effects of the coronavirus, even from those who would have the worst reactions to having the virus. Basically, you just have to, viruses, they work themselves through your body. Yeah. And so you want to be able to take drugs, even if there isn't a vaccine, you want to be able to take drugs that will mitigate the effects of it basically to your lungs. At the worst case, your lungs fill with fluid and you basically drown. That's a real problem, obviously. You get pneumonia. If you're susceptible to pneumonia, getting the Wuhan virus is not a very good thing to happen to you. But if there are drugs that can help get you over that hump, to get you through it, to get you past that first week, you should be fine after that. And the United States is positioned better than any country maybe in the world, in history really, to be able to deal with something like this. Certainly better than China was, because in this country we actually talk about things openly, and we don't arrest people, and we don't tell doctors that are trying to get the word out early on back in December about what was going on. Our government doesn't suppress those people, throw them in jail, or make them disappear so that they can cover this up. That's really what's happened here, is that this is worse globally because China is the society that it is. It's a totalitarian, command and control society, and they didn't want the world to know what was really happening, and that it happened in their country. And now they're spinning these conspiracy theories that it was actually made in a lab in the United States and brought over to China by the U.S. military. So when the media criticizes President Trump for continually saying Chinese virus or Wuhan virus, he's really only doing that because of China's behavior, not just in the beginning when this pandemic began in China, but the way they have tried to deflect blame to the United States of all countries now when this is going on. David Harsanyi, I believe, is an acquaintance of mine, and actually I would call him a friend. He used to write for the Federalist. Now he's with National Review. I believe he tweeted the other day he'd like to just call it the commie virus, because that's really why this virus spread so fast across the world. It's because a communist country in China had suppressed the news of this and didn't accept help for this and tried to cover it up. And that's why, and it's a communist country that made this happen across the world. So my worry about getting the virus and having severe health problems because of it. It still remains a 3. I think it's very unlikely that most of us, even if we get it, are not going to have the severe reaction to it that many others would, and we will have drugs and treatments that will help us get over the hump and get through it. And I think my level of 7 for the panic of the United States over this coronavirus has now dropped down to about a 6, maybe a 5.5. I feel like we're in like season 2 of The Walking Dead, where everybody knows this has already happened. Everybody knows it's crazy out there, and people are just starting to settle in to living life a little bit differently now because of all the panic. I mean, my wife, again, went to the store today. She reported that she was in line for a half an hour, but, it was pretty orderly. Things weren't completely running out. And so I think what we're really actually going to learn about all of this is that the panic was overblown. The panic was not necessary. The hoarding of all of these materials from grocery stores and Home Depot and other places was not necessary. And I do still hold out hope, as Justin Haskins had said on the podcast last week, by midsummer, this is going to be behind us for various reasons. The economy is going to come roaring back because now there's a lot of pent up demand. And I think that's what we have to look forward to. So I'm not all that worried still.
Mm-hmm. Yeah. So basically the structure I want to do this episode in is, first, I want to talk about kind of the government response and just basically society's response to this so far. Then some policy perspectives and how it kind of touches on some of the topics that we talk about on a weekly basis here on the podcast. And then lastly, just basically how to survive the quarantining or the social distancing that we have. Basically, what TV shows are you keeping yourself busy with? But we'll save that for the end. So first, I just kind of want to talk about kind of the government response or society's response with this, which has basically been so far social distancing. So basically, if you don't have to go out, don't. They've broken up events that are over like 50 people. I think more than that's like the CDC guidelines. I think some states are even more strict about that. Obviously, there's shelter in place orders for different towns and states. I believe that's the terminology that they're using in California. So let's go with Justin. No, let's go with Isaac first. Social distancing. How are you dealing with that on a personal level? And what do you think about that in terms of society as an effective way to kind of tamp down or mellow out the curve, as that one guy was saying?
It's been rough. I'm an extrovert. My girlfriend's an introvert, so I've been driving her crazy at home, and we only worked together at home for one day. That was yesterday. I don't know, man. I'm just like playing Age of Empires 2 Definitive Edition and like going for runs and stuff because this is bad.
Right, but do you think like the idea of stopping group gatherings of more than 50 is something that the government should be doing?
I think that it's an effective way to curtail or at least, spread out how many people get it. Like, do I love the fact that we're being told that we have to do this? Like, I don't like being told to do anything. So, but I do think it's probably effective.
All right. Jim, we're in Illinois, which is one of these states where they close down all the restaurants. There's no dine-in. You only can get takeout. All the bars are closed down. I mean, little too far, too early, or is this just being, preemptive about some of the potential here? You muted yourself again.
Sorry, I'm a bit of an introvert and a bit of a homebody, so it's not. This isn't a big stretch or cramp in my lifestyle, to be honest. We don't go out to restaurants a lot, and I'm not a regular bar patron. But what troubles me a little bit is that it seems the reflex to control the citizenry. There's some itchy trigger fingers among governments out there, Illinois included. I used to live in what I like to call the People's Republic of Oak Park, Illinois. It's a very left-wing town. They wear their virtue signaling on their sleeves. They're very proud of how progressive and they are as a society. They're very woke. They're very forward-looking. They really look down their nose at other communities in the suburbs. It's the first suburb west of the city of Chicago, the city limits, and they're very proud of being an urban, urbane suburb, but they are nonetheless a suburb, and they look down their nose at the other ones that are farther out, the exurbs, I guess, as not being as woke as they are. 3 days ago, they actually instituted a shelter-in-place order, and I believe the penalty for going outside unauthorized, I guess you're authorized to go to the grocery store, I suppose, or maybe to the doctor, but the penalty was a $2,500 fine and arrest, subject to arrest, and you may be jailed if you violate their shelter-in-place order in the village of Oak Park.
Well, I mean, they're letting everybody out of jail right now because of this anyway, so...
Right. So they let the criminals out of jail so that the law-abiding citizens who are wandering around actually there's room to put them in there.
That's right. You violated your curfew, sir. You're going to jail.
You're going to jail. And the funny thing is like they would be the first community to call Donald Trump a fascist, right? He hasn't locked down the entire country. Yet where does the fascism come first? In the very left-wing community of Oak Park, Illinois, and I'm sure. Look, the state of California. Is there a state that is more lefty and woke and liberal and supposedly anti-fascist than the state of California? There are 40 million people that live in California. They are all on shelter in place, and what is going to be coming next? The National Guard rolling through towns on tanks to make sure people stay at home. I mean, this is getting a little bit out of control, and it is the left-wing states and communities that were the first ones to basically impose de facto martial law and fascism upon their communities. I just thought that was worth observing.
Yeah, well, Justin, I want to get you in on this because you might be the person that's being most affected by some of these shelter-in-place. I don't know if you want to get too much into it, but you are unable to travel through the state of New York, which is preventing some of your plans. So I don't know. What are your thoughts on that?
Yeah, so essentially, America, here's the deal. I am trapped in Rhode Island. I cannot get out. I'm supposed to be moving to North Carolina, which I consider to be real America, but I can't get there because in order to get to North Carolina, I don't mean to give you guys a whole geography lesson or anything, but essentially it's not possible to get to North Carolina from New England without driving through places where they already have these bans in effect, or they're very likely going to have them into effect soon, especially New York.
Yeah, but
so
they're both coastal states.
What do you mean?
You don't have to drive anywhere if you don't want to, Justin.
So you want me to take a boat?
Yes.
With all my possessions? You want me to put all my possessions?
There's U-Hauls. Take a U-boat, sir.
I'll work on that, Isaac. All right. I'll try to find. I don't know if in the middle of an outbreak, a viral outbreak, it's a good idea to put myself trapped on a boat. But
nobody will be using their boats right now. Just go get one at the harbor.
Yeah. Okay. I'll work on that. My wife gets horribly seasick. By the way, just to
give her some Dramamine. There are solutions to all of these. Plus, I believe Heartland has an ark somewhere that you can use.
That's a good point.
No, that's a good point. Yeah, if it doesn't, we should start building that.
Yeah, that never got off the ground. That was our idea. I'll come back to you in a minute, Justin. But the idea of a shelter in place, I want to get into because this might have some implications for people going forward. There is rumors here. Now, take this with a grain of salt. There is rumors that there could be potentially a national shelter in place being declared sometime soon. Okay, that doesn't surprise me too much, and I'll tell you why. It's because I think that a lot of this is mass hysteria, and that doesn't mean I think any of this is a hoax or that we shouldn't be taking it seriously. But I think that there is an arms race going on politically for which side is taking it the most seriously. So everyone's trying to out-serious each other in taking this. So the idea that there will be a national shelter in place, I think, is inevitable unless there is some type of medical breakthrough that's really curing people at an incredible rate, but I don't think so. So what is a shelter in place? So pulled up this article. It says the basics of a shelter in place during the coronavirus pandemic is basically very clear. Stay at home. And now there is different exemptions for essential activities. So what are these essential activities? This includes tasks essential to maintain health and safety, such as obtaining medicine and seeing a doctor, getting necessary services or supplies for themselves and their family or household members, such as food and supplies, pet food, and supplies necessary for staying at home, engaging in outdoor activities such as walking, hiking, or running, provided that you maintain a 6 feet social distancing, and caring for a family member or somebody in another household, and caring for elderly, minors, dependents, such as people with disabilities and other vulnerable people. So, Jim, I'm going to go to you with this. Like, how do they enforce that? You mentioned the Oak Park, the $2,500 fine. But how do you actually enforce that? Like, are police just pulling people over and going down the street and saying, "Where are you going?"
What if the police were like, I have to keep 6 feet away from you, but I want you to stop right now?
Yeah, right. Roll down your window.
Social distancing. You're under arrest.
So, yeah, arrest yourself or something. I don't know.
I'm going to leave the ticket on the step here. You pick it up after I leave.
Right. I don't know. It was interesting, as I heard on the news last night here in Chicago, that police stations are no longer open to the public. And so they're trying to enforce, somewhat shelter in place in the city of Chicago. And the police are supposed to, I guess, be enforcing that. But the police are also not going out there and patrolling the streets anymore because it's not safe. They have limited people in the lobbies of the police precincts in Chicago. And they're discouraging people from coming. So I don't know how you enforce all these things. But the government really needs to figure something out, because it could turn into anarchy very quickly in a lot of places around the country if you can't keep law and order. I mean, I don't want to be paranoid, but you're getting me paranoid, Donnie. And it's the idea that we could have social disorder on a broad scale in many locations around the country, and it could escalate very quickly. This is all unprecedented. Nobody listening to this podcast, nobody alive right now has ever experienced anything like this, where the entire country is being told right now to voluntarily socially distance themselves from everybody. They're told to not even have a family gathering of more than 10 people. There's a joke on Twitter that Phillip Rivers, the quarterback for the LA Chargers, I think he has 10 kids, so he has to put 2 kids out in the garage, because he's got too many kids to safely gather together as a family. But this is completely unprecedented. And so when you say, well, what's going to happen? We don't know, because we've never been asked to do this as a society before. And you add to that the idea that, society's become a lot more fractured over the last decade or so. Social media has actually driven us apart and not brought us together as a society. There seems to be not a sense that we're all in this together, and we need to do this to help each other and help the country get over this pandemic. I mean, I'm doing my part, and a lot of people are doing their part, but it doesn't take that many not doing their part, and then governments overreacting to that for things to really start falling apart. I really hope that doesn't happen. You're adjusting my worryometer back up to 8 now for how society is reacting to this, because there is no precedent for this. We have no idea how this is going to turn out. We're just hoping for the best. That's pretty scary.
Isaac, do you think that this kind of just the fear over all of this has already irreparably changed like society and how we interact with people? And I asked this because I was watching like a TV show the other day, and it was like this thing on basically they had like a group of people, and they were doing like social experiments on a bunch of different people, and they're all in like the same room together. They're all shaking hands at different parts. And I was just thinking like, oh, that's not what we would do today. And I just wonder if like we're just going to quickly go back to that, after all of this kind of burns its way through the society, or if like we have changed as a society. Is the handshake dead is basically what I'm asking you, Isaac.
Unlike the U.S. economy, I think that the handshake will have a roaring comeback once this is in the rearview mirror. I don't think anything like that's going to change. It'll go back to normal.
Yeah, even like kind of big gatherings and giant social events, big like Comic Cons and conferences like that. Like we're just all going to go back to that. Like no problem. Like
yes, 100%. We still did it after the Black Plague, Donnie, and that killed way more people. We did it after the Spanish flu. Maybe that's humans never learning their lesson, or maybe it's just we're going to do it. So I think that historical precedent here is we're just going to go back to handshaking, bumping fists, doing weird stuff like.
Well, Justin, okay, how about going back to that idea of has society changed? Like, there's different things that have changed in society after the last biggest thing that's ever happened in our lifetimes, which was 9/11. So, I mean, like our systems of operation, our societal norms going to change because of this?
No way. No way. I think that everything, as soon as it looks like everything's going to be okay with this, I think the world's going to go right back to the way it was before, like it never even happened. And I think 3 or 4 months after it kind of finishes and you don't really have lots of new cases, it's just going to be some crazy thing, some crazy event that we all experienced, and it's not going to have an impact on our society at all.
So you think this is just a bad acid trip?
Pretty kind of, yeah. A costly one too. Very expensive. I think that people are extremely, extremely resilient and have a tendency to. I think society exists, sort of cultural norms and all of that have been developed over a very long period of time. They exist for a reason. They exist because that's what people want. Now, you can say that people want the wrong things or whatever, but they develop for a reason. And I don't think those reasons have gone away permanently. I mean, at the foundation, those reasons still exist for why people have the lives that they have. I think that it will go back to that as soon as there's no reason to interrupt it. And right now there is a big reason to interrupt it. And that's why we're seeing it. And people should interrupt their normal lives. They shouldn't be living the way they normally live. But once this goes away, I think people will go right back to the way things were before. I don't think much has changed. I think the really big thing, though, is there is one big asterisk to this. And that is, if the economy is severely damaged over a very long period of time, not a short period of time, but several months, say 6, 7, 8 months, if this drags on and on and on, then you're going to have lots of economic damage, which is going to hurt a lot of people and change their lives. And that is something that may have an impact on society in a lot of different ways, not just in terms of how much cash people have in the bank, but really in the way that people live their lives. Is your favorite restaurant even going to exist 6 months from now? I don't know. I mean, those kinds of things, yes, I do think that there could be some permanent damage or not permanent, but long-lasting damage that results in this if that occurs. But like I said before, I'm holding out hope that it's not going to last 6, 7, 8, 9 months. I think that we're going to start to see things improve over the next couple of months, maybe 2 to 3 months. And after that, I think it's just going to be all downhill from there, and people are going to return to their normal lives pretty quickly. In fact, I think you could see a huge economic boom. It's possible that you'll see a huge economic boom right before the election. I think that's entirely possible that could happen as a reaction to all of that pent-up demand that Jim was talking about.
So, Jim, how about just like the response from the government? So, I mean, obviously all the news just completely has been coronavirus. And so I've been trying to limit myself on how much of it I'm exposed to. But like, obviously, because of this, I have to keep an eye on it somewhat. But, I'm hearing like various different things that the government's going to do to try to help the economy kind of in the meantime while we're suffering through this. Some of the stuff is basically the equivalent of quantitative easing. You've heard about bailouts for certain industries, including airlines being kind of tossed around. I've heard recently, like the government may be cutting everybody $1,000 check every month for the foreseeable future. I guess, A, what's happening, and B, your opinion on that.
Well, as I mentioned before in my last little rant, I mean, this is all unprecedented. We've never seen something like this happen in the United States, where basically the entire country is told not to go out there and go to restaurants. I mean, restaurants, they work on very, very tight margins. One of the worst businesses you can think of opening is a restaurant. It's very difficult to get started. It's very difficult to maintain. You have your favorite place and you think it's always going to be there, but they work on very, very tight margins. Putting aside the poor servers who are now cannot show up for work for at least a month. How are they? And they live on tips, and they don't. they live on the edge. There are millions and millions and millions of people who live paycheck to paycheck in this country, and they don't have a lot of savings, and they're wondering what they're going to do. Hey, I know, maybe I'll drive Uber. That's right. Nobody can go anywhere. Where am I going to take somebody? I'm not going to take them to the airport because nobody's flying anymore. I mean, the economic impact of this is so enormous. And when we see the figures start coming in as to the amount of joblessness or the people that are unemployed after the end of March, it's going to be an enormous number. When we see the economic activity in the first quarter here, at the end of the first quarter of 2020, it's going to be a shocking number. And there's another factor here, and it is, people will find a way. There's black markets and things happen, but those things don't get recorded in government statistics. But, I know Justin is very hopeful that this will all be blow over. It'll all be, by June or July, by July 4th, we'll all be having a big national celebration that we got over Wuhan virus, and now we're roaring again, and everything's going to be great. What if we have to stay locked down, sheltered in place for 2 months, 3 months? Does anyone really believe that Americans are going to put up with that? I mean, you can shelter them. China can make its people shelter in place. It will arrest them, or it will weld their doors shut, or it will put the military outside of the city limits to keep people from leaving. This is not what we do in America. This would have to be voluntarily done in order to have chaos not reign. Does anyone actually believe Americans are willing to just sit around at home for 2-3 months, ordering out and maybe, eating their canned goods? I don't think it's going to happen. So, I hope that we've already done so much that we need to do to flatten the curve, and that this kind of thing doesn't have to extend be much beyond the end of March. Because if it does, I don't think this country is willing to do it. I think you're going to see people rebel against that, and that might make the coronavirus spread even more. We don't know how any of this is going to work, and we know that the government has a great interest in keeping this virus tamped down, flattening the curve, as they say, as much as possible, not just because of health reasons, but for economic reasons. We have to be able to get our economy and our life back as quickly as possible. And if that was to take 2 months till the end of May, till Memorial Day weekend, basically living as hermits all across the country, I don't see us being able to do that as a society. And the economic damage, if we were to do it, would be so severe that people just feel like they have no other choice. They have to go out and do things. So as this podcast goes on, Donnie, I keep getting more and more worried about what's going to happen, because I don't think the government has any good answers. $1,000 a month to people, that's not really going to help that many people. We certainly, as a society, can't even afford to do that, let alone make everybody whole. Most people make more than $1,000 a month, and they have rent, and they have mortgage payments, and they have car payments, and those things are going to start to get disrupted. There isn't a good answer for government on this. I think people just have to stick it out, because ultimately what this will prove is that we're all on our own.
Yeah, well, it would be interesting to see kind of what happens. I'll take your worry number at the end of the podcast. Point on.
Maybe we should all do that.
Right.
It was a good baseline.
Yeah, right. So I kind of teased this last time, but this is a report done by the Heritage Foundation, and it was sound policy responses to the economic consequences of the coronavirus. So in here, it kind of talks about like the reasons against some of the emergency solutions that are being kind of thrown out there. And one of the things that they're suggesting might work is an epidemic tax credit. So an epidemic tax credit, as proposed, the epidemic tax credit would pay for 90% of the costs of providing paid leave to employees who can't reasonably telecommute and who work in declared epidemic areas. It would take effect immediately and would not require the delay and expense entailed by the creation of a bureaucracy to administer the program. Under the proposed credit, in the case of an employer, the tax credit would be the amount equal to the applicable percentage of the amount of applicable wages paid to qualifying employees for a period of up to 8 weeks. So this is a solution that I've kind of heard discussed here and there. It's called different things, depending on who you're listening to. But this is basically to kind of keep the economy as it is now. And not have to go through all of basically a giant boom and bust cycle here where everyone gets fired, the coronavirus goes away, and then we have to start rebuilding the economy. This kind of keeps it all in place for these 8 weeks or however long it's supposedly going to go. And then so that way, once we get through the kind of the dark ages here, we can just kind of keep going on how we've always been going on. I guess the big problem with this is the cost. So Justin, I mean, the cost of something like this is that I mean, it's seemingly like in the face of a disaster, the cost should be secondary, but could the solution be worse than the problem they're trying to solve?
The thing that I'm really nervous about with all of these proposals that are being offered now is that there really is no one saying, well, it's all about what should we do and not do we even have the financial capacity to do it. Normally, when you make decisions based on economic decisions. You make decisions based on how much money you have available, how much resources you have. We don't seem to be interested in doing that anymore. We have no money. We were on track to run $1 trillion deficit this year, regardless of all of this, prior to all of this happening. I mean, now they're talking about $2 trillion, maybe $3 trillion deficit. I mean, things that we've essentially never seen before. There's no money for any of this. It's all being printed. It's in effect. It's all going to be printed by the Fed. It's all going to be pumped into the money supply. We are going to give government a massive amount of power. I saw an article the other day that said that, or I think it was yesterday, that said that at a press conference, Donald Trump said that he would be open to the idea of using the federal government to buy parts of companies, private companies.
Yep.
I mean, these things are really, really dangerous, and there's no money for any of it. But not only that, it's shifting steadily, and we saw this really start to pick up with Obama at the beginning of the Obama years, and really at the very, very end of the George W. Bush years, where the government started printing lots of money and then using that money to directly and indirectly control the economy. Or heavily influence it, let's say. Mm-hmm. And now what I'm worried about is that all of these programs, all these plans, all of this money being spent is only going to make this much worse. It's going to add to that problem going forward into the future. And I think we are moving so far away from economic reality that and creating all kinds of distortions in the economy that are going to last for and the money supply especially, that are going to last for a very, very long time, that conservatives should be stopping and thinking very, very carefully about whether we should be pursuing any of these actions without some kind of plan alongside it that demands that this money get paid back and actually creates a mechanism for that happening, whether that's some kind of tax that kicks in a year from now or something that ensures that we're not just running off the fiscal cliff entirely and saying, well, it's a crisis, so there's always going to be a crisis to some degree. Okay, I know this is unprecedented, what we're experiencing right now, but it seems like this happens every 10 years, some kind of unprecedented crisis. And over time, government has taken over more and more and more of the economy. And this could be a giant leap forward in that direction if we're not really, really careful. So I think there has to be some kind of mechanism in place that ensures, that guarantees that this is going to get rolled back and that we're going to pay back this money somehow, and that we're not going to let the government put programs in place that are permanent, and that we're going to return to fiscal restraint at some point, or at least in some sense of that word, because we really haven't had that in a very long time, but in some sense, we're going to return to fiscal sanity. And if we're not willing to do that, then I mean, what's the difference between conservatives and liberals? I mean, essentially, it's just a varying amounts of money that they want to spend. I mean, beyond what they have, is that really the only difference between us now? We have to rein this in before it gets too far out of control.
And like, you can make a really good argument that it's not even how much money we spend, but it's where we spend the same amount of money, right? And I think that's one of the frustrations that, people like me, Justin, and Donnie, as younger folk, who, probably were disenchanted with the George W. Bush years, have been voicing for a really long time. And I think that's why we identify more as libertarians than conservatives on this stuff. But one of the things that's, if you want to get that rating up from 8 to 11, start looking at what Peter Schiff is saying on Twitter right now, because one of the reasons that I'm worried that this is not going to be an easy bounce back from the recession that we're causing right now is, what if everybody remembers that this has all been financed on super low credit or low interest rates, and it's all funny money? Because if that happens, and this is just the straw that breaks the camel's back, so to speak, then I think that we're going to have a really big contraction, and that is going to be bad because markets always clear.
Yeah, I did see that. I did see what Peter Schiff said on Twitter, and it did trouble me. So I stopped reading it for a while. I have to take it in pieces because it can be really depressing. And then I think, he actually very well could be right. And Peter Schiff is a very smart man. But we've been told that, quantitative easing was going to cause, almost irreversible economic problems for more than a decade. We're told that we can't keep deficit spending, that we have to balance the federal budget, or else we're all going to go under. And it hasn't happened. Eventually one day it will happen. And maybe the Wuhan virus recession is going to be finally the straw that broke the economic camel's back here in the United States. But if it finally happens, it would be after at least 20 or 30 warnings that this was going to happen. So as worried as I am, and Peter Schiff is very smart, we've heard these dire warnings before, and they just haven't really come true. So that's knocking me down half a notch on my worryometer for the economy, I think.
Sure. I guess, Justin, go ahead. Oh, okay, I'll go. The thing about it is the mortgage crisis was people buying really bad derivatives and, gambling on, the loans that people were making that they couldn't pay back in the mortgage industry. But now it's not concentrated just the real estate market. People lost their butts in their houses because they thought the market was going to keep going up. But the low interest rates and the rates that have been so low for so long have basically inflated every asset class. And I think that's what's the most troubling to me.
Yes, I totally agree with what Isaac just said. And I would argue that the 2008 crisis was totally a result of that as well. They had pumped all this money into the economy in general. A lot of that made its way into the lending market. That, coupled with really stupid regulations and requirements from the federal government and on banks and mortgage companies and that sort of thing, spurred that crisis, allowed that crisis to happen that otherwise would not have happened without government. I mean, without government, there's no way that 2008 crisis would have occurred. And I think what Isaac said is exactly right. What we're seeing is all sorts of different markets being inflated. I mean, the student lending market to me is one of the best examples of it. In the midst, during the Barack Obama administration, the cost of attending college increased by more than 20% in the middle of a gigantic financial recession. Now, how does that make any sense? The reason it makes sense, or the reason it happened, is because the government essentially allowed and encouraged even people to take out as much money as they could possibly take out to pay for whatever they needed to pay for to go to college. And that, because colleges knew that all of these people now had access to this money that was being given to them by the federal government, they jacked up all of their interest rate, all of their tuition prices and all of the cost of attendance. And then they used that money to pay administrators more money, hire more administrators, build new college buildings, etc., things that were not necessary. But they had all this money floating around, and it created a huge, gigantic student loan bubble. It still exists. And that is crushing a lot of younger people right now. And that's just one part of the economy. The whole economy is full of these bubbles. They're all over the place. And they're created because the money that exists in our economy right now was put there, not because of supply and demand, but because the Fed wanted to encourage people to spend money when they actually thought it was not a good idea to spend money. And if you think about it, that's exactly what is happening right now. That's what Fed policy is all about. It's let's pump all this money into the economy so that people who right now are worried about spending money feel a little less worried about spending money. Let's pretend that little voice in your head that says, I don't think it's a good idea to spend the money I've got in my pocket right now. Let's overwhelm that voice with a bunch of cash from the government. That's what's happening right now, and it creates distortions that last for a very long time. And even if the Peter Schiffs of the world are wrong and we're not going to see some huge problem that occurs as a result of this in the very near future, I do think it's inevitable, but let's say it's not in the very near future, it still gives government more power. The more money that the government is spending, the more power over the economy it has, and that is exactly what's happened in other countries around the world that have pursued these policies, like in Japan, where essentially the government is crowding out the private sector entirely and taking over almost everything, and they're doing it because their version of the Federal Reserve is encouraging the government to do this with negative interest rates. And what has been the result of that? 25 years of absolutely no economic growth. The GDP in Japan in 1995 was higher in terms of real dollars, in terms of current dollars, was higher in 1995 than the GDP is today in Japan. Think about that. 25 years, no GDP growth at all. That's a lost 2 decades as a result of this kind of idea. And America is running toward that right now, desperately, in the hopes of trying to get through what might be several bad months. And I just think that's why I said before, I'm not saying we shouldn't do something. I'm saying whatever we do, there needs to be a corresponding policy that ensures that this all gets rolled back at some point in the future. Maybe that's a small national sales tax. Maybe it's some other kind of tax. I don't know. But we need to have some kind of fiscal restraint here, or else we're going to end up like Japan.
Remember when we used to just talk about the stupid things Joe Biden said this week and just how terrible Bernie Sanders is doing in the polls? And remember that? That was fun.
That was fun.
Those are called the before times, Donald.
Yeah. Just a couple of other things to kind of get to. I want to get to in the policy realm here before, and I do want to do that. Just what are we watching? Because we're all going to be inside for a long time here. So a couple of
Donnie, would you say that what they're proposing right now is exactly like modern monetary theory?
Oh, yes. I mean, hey.
Get it in,
Donnie. What all of this is. That's exactly what Japan is doing. Spending money with no regard. Even like some of the stuff that Jim was talking about, where we're spending all of this money and we're saying that there's going to be a crash, but there hasn't been one. That's basically what Stephanie Kelton has been saying. So this is the road to modern monetary theory, which is the road to socialism. Yes, sorry, Isaac, you got me.
Stephanie Lakely on the line.
All right. So a couple of things. The first one kind of ties into my question about is society going to change based on what's going on here? And obviously in the face of all this coronavirus stuff, schools have closed down. So I have a report here. This was an article that was done by Lindsay Burke, who is an education specialist at the Heritage Foundation. She wrote an article saying that we're all homeschoolers now. And she talks about how when this article was written, she said that there is 33 states that have closed some 64,000 schools. I think it is pretty much every state is closing down their schools now. And then basically how this is opening the door to more digital learning, homeschooling resources, and basically stuff that goes along with those lines. And that some solutions that are being proposed look very similar to education savings accounts. So I'm wondering if there is a silver lining, even if this is just not as crazy as it might be, is the silver lining that maybe we kind of get ourselves off of this government-controlled monopoly of the schooling system, and that we can actually open the door to more education savings accounts and more digital learning and homeschooling type things. Isaac, do you think that there's any possibility of something like that happening?
So when you said that is the society going to change it all, and I said no, I think this is where it could, because I think that there's been a growing trend towards, especially in rural areas, not having enough teachers, so they're looking at incorporating online learning into the curriculum. So now that everybody's forced to do it, and they're going to be like, why don't we just do this for everything?
Right.
I do think that will potentially change as a result of this. So you are right, Donnie. I was wrong. You're smart. I'm stupid. You're attractive. You're very good looking, and I'm not attractive.
Well, Thank you for the apology.
Yeah, exactly. You're welcome.
So the other thing, unless either Jim or Justin want to jump in and echo that sentiment on this, I will also mention the idea of con reform. So a lot of these state level think tanks are looking at the policies that are in place in their specific state. Anyone that's listened to this podcast long enough has heard us talk about certificate of need laws, which I'll probably do a terrible job of explaining, and Justin can kind of clean up the mess that I make. But it's basically where healthcare services, healthcare providers, hospitals, and the like have to get government permission to get new equipment or, add on places or even establish new hospitals in the area. So all of these groups are suggesting that now is the time, considering hospital bed shortages, that this would be the time for states to reform these stupid, outdated certificate of need laws and basically get the free market back into play here. Justin, I'm sure you have plenty to say about certificate of need laws.
Yeah, so con laws are something that the Heartland Institute has been talking about for a very, very, very long time. They've been around since the 1970s, or actually they may have even been around before that, but 1970s is when they became really popular. There was a law passed, I think it was in 1974, a federal law that essentially tied money, federal money, given to states for healthcare to whether those states had certificate of need laws in place. So that doesn't exist anymore. They don't have that same kind of tie anymore. But what it did was it encouraged all these states to create con law boards, and that's exactly what states did. I think every state had con laws in the 1970s. And essentially, how they work exactly the way Donnie described. You've got a board. They're often, it's a bureaucracy. It's just another level of bureaucracy in government. If you're a healthcare provider and you want to provide a new service, you want to add a new machine to your service, you want to build a new facility, you want to expand a facility, you need to go to this board and beg for permission to do it. It's essentially how it works. Now, you may be thinking this just applies to hospitals. It doesn't. In many places, it applies to all sorts of different kinds of healthcare facilities. Private practice physicians would be required to do this. Nursing homes in many places have to do this. So if a nursing home wants to add more beds to their facility, like say they want to add 10 more beds, they would have to go to this con board and ask for permission to do that. There are about 36 states that still have con laws. Many of them got rid of them in the 1980s because they were a disaster. And the Mercatus Center, which is really good on con law stuff, if you ever are interested in learning more about con laws and you can't find the answer on the heartland.org website, then go to the Mercatus Center study or the Mercatus Center website. They've got all kinds of really good studies there. And one of the things that they found was they analyzed healthcare access, cost, all sorts of different factors of con law states versus non-con law states. And what they found was that in places where you have con laws, access is reduced, you have fewer hospital beds on average, you have fewer healthcare facilities on average in many cases, costs are significantly higher. It depends on the service you're talking about, but in many cases, costs can be higher. They're just really bad. They don't work. Now, in this particular instance, why are we talking about it? We're talking about it because con laws over the whole country, wherever they exist, they generally speaking reduce access to facilities and also just hospital beds in general. Now, that's important because if we do have a gigantic outbreak of coronavirus, we're going to need lots of hospital beds. I saw one estimate from the Department of Health and Human Services that said that if we have if this outbreak gets as large as an influenza outbreak that occurred in 1968, a large influenza outbreak that happened then, we would need about 1 million hospitalizations. 1 million hospitalizations. Well, there's only about 1 million hospital beds that exist. So that's a problem. And the reason why there's only 1 million hospital beds is in part because you have these con laws all over the country limiting how many hospital beds you can have and limiting how many hospitals can exist in a given area. To give you some sense of just how dramatic this can be in some cases, the Mercatus Center when they analyzed con laws in New York State, not just New York City, but in the whole state, they found that there are currently 224 hospitals right now in New York. Or actually, I think this came out in 2017. So 224 hospitals in 2017. If there had been no con laws, they estimated that there would be 317 hospitals in New York. So 224 to 317. So you're talking about a difference of more than 90 there, right? So 90 additional hospitals. Now, if you have a gigantic healthcare crisis, 90 additional hospitals will be useful. That would be very useful. And that, I think, is the point that we want to make, is that this isn't based on supply and demand. It's not based on what consumers want. It's not even based on what healthcare providers want. It's not based on what health insurance companies want. It's based entirely on what government says should exist. And when you have that, because this is really just a really elaborate price control system when you think about it, when you have these price controls put in place, supply and demand isn't working, you end up with shortages. And that's exactly what we have right now.
So just for an update here, I just got sent a picture, a screenshot of a Chicago Tribune article. It says Governor J.B. Pritzker to issue lockdown order requiring residents shelter in place starting Saturday, sources say. So for all of our Illinois listeners, going to be inside a lot coming in the next few months or so. So, guys, what are you watching? How are you keeping busy? I know that we're all working because we're in the think tank. We can telecommute or whatever. But what have you been watching? I've been going through Curb Your Enthusiasm and Shark Tank, so that's not going to keep me busy for too much longer.
Shark Tank's a great show.
Isaac, are you still watching that gold digging show or whatever?
Gold Rush. And we got a little tired of it. It's kind of the same show every week. It's like, oh, the equipment broke down. Oh, I guess we got to fix the equipment. Then it's like, all right, weigh the gold. it's pretty cool, right? But it does get a little repetitive if you just binge watch it. So,
anything else you've been watching? While you think on it, Jim, I know you're doing 30 Rock. Don't bore us with that. What else are you watching?
Yeah, I've been watching 30 Rock. We've been getting through that. And by the way,
watching Mr. Ed again for the 8th time.
I Dream of Jeannie is very good. My three sons. Actually, I started watching the show The Outsider on HBO, which is I've heard some good things. I think I'm about to start episode 4. It's a little slow. I'm interested, but it's a little slow. I hope it kind of picks up a little bit. And I also have to finish watching The Expanse, which is a great sci-fi show that I've been slowly watching, and I'll probably finish that off pretty soon.
So does that HBO show that you're watching make any sense at all? Because we started watching Watchmen, and it's just like every HBO show doesn't make any sense. It's like their new theme. Welcome to Westworld. Nothing makes any sense at all. And then it's Watchmen. It's like, good luck figuring this crap out.
I know. Westworld did just start up again, and I'm going to probably start watching that. I'm probably going to hate watch it now because I really don't think it's going to be very good.
Well, I am interested in that. I'm going to hop on HBO soon because there's a few shows that I want to watch. But you're right. That seems to be it's only good if you can't understand it.
Yeah.
So, season 2 of Westworld was a nightmare.
They just basically take a script, put it in a blender, and they're just like, all right, everybody, enjoy the crap.
Yeah.
Well, Outsider is based on a Stephen King novel.
Okay.
So I think it's more of you can correct me if I'm wrong here, but it's more of a detective kind of thriller, right?
It is, but there seem to be some supernatural, unexplainable things, maybe parallel universe stuff going on. I'm trying not to read about it, but it's very weird. And it's Stephen King, so I figured you would love it, Donnie. You love Stephen King, so you got to check it out.
Yeah, I'm going to check that out for sure. Justin, I know you've got a whole bunch of stuff going on. You watching anything?
I actually am watching something somehow. I don't even know how I'm fitting it into my life, but I somehow am. I'm watching a show called Devs. I don't know if you guys know the DEVS. It's on FX, which I normally do not watch, and so you can stream it on Hulu if you have Hulu. It's actually, I think it's a really, really good show. Episodes in. It's a new show. just came out, so there's only 4 episodes available right now.
Okay.
The main plot is that you've got this Google-like company that's working on something very mysterious that they're not willing to share with other people, and they've got this sort of Google campus kind of thing, and somebody makes their way into that world. They get sort of selected into that development team that's working on this secret project, and they end up getting killed off. And it's sort of this developer's girlfriend, who also works at the company, kind of trying to figure out why that happened. And it's pretty interesting. Nick Offerman, believe it or not, for those of you who know Parks and Rec, this is Ron Swanson, is one of the main characters in the show, playing it's a very dark, sort of serious show. And he is fantastic in this role, which is really interesting because he's famous for being a comedian, not for playing dark roles like this, but he's really, really good in the show. So I recommend it. It's worth watching, especially if you've got 3 months to kill or whatever.
Yeah, no kidding.
Yikes.
All right. So we are planning on doing this show as the weeks progress. I'm going to take a microphone home. Might not be able to come to the office here to record, but I'm going to try to bring some equipment home so that we can do it. Probably won't see our bright shining faces on the YouTube. Might be just an audio only for the next couple of weeks here.
Oh, you plan on going every single day to provide people with new content so they don't go stir crazy.
No, because then we would just talk about coronavirus every day and it would be a nightmare. So you already made me depressed at the mid mark of this episode. I was like, how am I going to brighten this up by the end of it? But did my best.
Okay, so quick. How's everybody feeling? Scale of 1 to 10. Let's do it again. Jim, go.
I'm back. Actually, I've calmed down. I'm back down to a 7.
Oh man, I'm at where I'm at. Justin, have you figured out your U-boat to North Carolina yet?
Working on it.
Cool.
Working on it. All right, audience. Thank you for joining us, listening to this episode of the In the Tank podcast. Please join us every Friday for a new episode. If you like our show, please subscribe, rate, or review for us on iTunes. We greatly appreciate it. You can find us on SoundCloud, Stitcher, Google Play, pretty much everything nowadays. YouTube, I don't know. We'll probably still have it on there, but it'll probably just be an audio version. If you'd like, you can follow us on Twitter at In the Tank Pod. If you have any comments, suggestions, questions, anecdotes, jokes, feel free to email us at inthetankpodcast@gmail.com. Justin, where can the fine people find you?
At Justin T. Haskins on Facebook and Twitter, and Trapped in Rhode Island. Come see me. Actually, don't come see me because you're not allowed to.
That's right. Jim, same question. Where can the fine people find you?
At Jay Lakely on Twitter. Find the Heartland Institute at Heartland Inst and also heartland.org.
And last but not least, Isaac Orr. Same question. Where can the fine people find you?
Well, you can find me on Twitter at The Fracking Guy. And if you want to find me in real life, I'll probably be heading home to Wisconsin to help my dad on the farm this week. So, Justin, sucks to suck.
All right. Thank you all for listening. Talk to you next week.